CO2 laser isn't new, but the type of what we call fractional photothermolysis is a newer topic in the field of what I like to call scar rehabilitation. Previously, I think surgeons, when we think about scars, we talk about cutting them out. But anytime that you remove tissue, you actually are creating a bigger deficit for the patient. And so we think that actually using the patient's own tissues and rehabilitating their scar as opposed to removing it leads to better outcomes. What it does is it creates these microthermal injuries in the scar, and when a scar occurs or a burn scar occurs, the body lays down collagen in a way that's disorganized because it just wants to get closed as fast as possible because its goal is to prevent infection. At the time of your initial injury, body, doesn't care how it looks, it just wants to get the wound closed. It's very effective at getting it closed, but as far as then if you were to continue with that scarring process, that scar is, in addition to not looking good, is painful. It is often causes severe itching for the patients because the nerves aren't able to grow back in the way that they normally do. It feels tight for the patients, so sometimes they aren't able to move with the same range of motion. And so what the CO2 laser does is it breaks up that scar and that abnormal wound healing that had occurred at the time of their injury, and then allows for normal healing, so then basically recruitment of blood vessels and new cells into that area that will then reform in a more organized fashion, lay down the collagen in a more organized fashion that will then help the patients with regards to that feeling of tightness, itching, pain, and also does improve the contour and how the scar looks. The CO2 laser is one piece of what I like to think of as a kind of an armamentarium of treatments that we offer for burn scars, but is a newer one that we have been able to develop protocols for here at the University of Michigan. I think the new laser treatment, what it does is it gives the patient an opportunity to have improved scar appearance, improvement in the tightness and the pain that they feel from their scar, decreased itching sensation that they get from the kind of disorganized way that the scar has formed. We offer kind of a global approach to their scars. So we're not just technicians and just, here's a scar, here's the laser for it. We look at the entire scar, and I think each patient requires different treatments of their scar. Some patients may not require any laser treatment. They may just require some steroid injection. Some patients may actually, require, if it's in a large area, we do other tissue expansion surgeries to remove the scar. And tissue expansion is something also that plastic surgeons do a lot of with breast reconstruction. So we borrow the technologies that we have learned as plastic surgeons from other specialties or other surgeries and use that to improve burn scars, because there's a lot of overlap in different types of scars. And so at Michigan, we have the ability to not just do a laser surgery, but do a laser surgery and other modalities to improve upon patients' scarring. At Michigan, we have a team that's really dedicated towards this whole process of scar rehabilitation, and we see scars from so many different types of trauma that we've learned from all those different types, and we're able to use what we've learned to bring, I think, the best treatments for patients with trauma and burn scars. And again, I look at it as a multimodality of laser treatment, steroid treatment, fat grafting, tissue expansion, and local tissue rearrangements to release any tightness.